Through a series of what I would refer to as pandemic response shifts since we started this journey together late January. The first strategy, as a part of our strategy of containment, began when we started to repatriate those first flights coming from mainland China, from Wuhan and elsewhere. The second phase was the mitigation phase, adopting strategies as we saw the first case of community spread to advance stay-at-home orders for our seniors, to begin the process of closing down our schools, population-based strategies to mitigate spread that included at scale a statewide stay-at-home order, and then the efforts to continue to practice physical distancing. We then started to move into the third phase, a phase that could broadly be described as the phase of surging our system, not only our hospital system, but our alternative care system to meet a potential demand that required not only physical assets, rooms, but also people and protective gear, ventilators, masks, gowns, coveralls, and the like. The next phase, the phase that I want to speak to all of you today about, is a phase that I would frame as an optimistic phase, that we move from surge and we begin to transition into suppression, ultimately on our way to herd immunity and ultimately to a vaccine. But in this transition, where we do see light at the end of the tunnel, where there is a ray of optimism and hopefulness that this too shall pass, it's also perhaps the most difficult and challenging phase of all. And that's to say a lot, because the last few weeks and months have been very challenging for all of us indeed. But this phase is one where science, where public health, not politics, must be the guide, where we must be open to argument, interested in evidence, where we cannot be ideological in any way, shape, or form in terms of how we approach a condition that changes on an hourly and daily basis, conditions that will ultimately determine what better decisions we make in terms of that transition. So today we want to create a framework and pass forward a process that we've been having and that we've been engaged in for the last few weeks, and basically pull back the curtain on those private conversations and make them public. So you'll get a sense of the questions we're asking and the questions we need answered before we ultimately can move out of a population approach where we are asking everybody to stay at home to a more individual approach to addressing the issues of suppression in the state of California, and ultimately get us back to that sense of normalcy that I know everybody watching so desperately looks forward to. We have a parameter, we have a framework that will guide our decision-making, and we'll make that very public in just a moment when I ask Dr. Angel to come up and avail ourselves, of course, to questions not only from Dr. Angel, but from Dr. Galley and others that are present here today. But the framework is predicated on the ability to do 6 things. The most important framework is our capacity to expand our testing, to appropriately address the tracing and tracking of individuals, the isolation and the quarantine of individuals, using technology and using a workforce that needs to be trained and an infrastructure that needs to be in place in order to begin the process to transition. I'll talk more about that, and we'll be more prescriptive in terms of what that looks like. The second phase is maintaining our vigilance on protecting the most vulnerable populations in the state of California from infection and spread. Primarily our seniors, those with immune order issues and specific strategies and interventions around addressing the needs of our homeless as examples of addressing those vulnerable populations as a top priority. Number 3 is addressing, again, the ongoing needs of our hospital and alternative care delivery system to meet the needs of potential surges as we adopt new strategies, as we loosen the stay-at-home orders ultimately and eventually potentially the prospect of increased infections and spreads. We need to make sure that that infrastructure is protected and to make sure that those assets are well prepared. PPE, not just, again, the masks and ventilators and gowns and shields, but also making sure that we have a myriad of other protective gear for that workforce, and to make sure that we're capable from an ICU perspective and hospitalization perspective to meet any additional surges. The fourth frame is to continue the work that we've been doing on a weekly basis, and that is to engage academia, to engage our research partners, to engage those that are on the front lines, and they happen disproportionately to be here in California, companies like Gilead, companies like Genentech, credible operations of support that are coming from our hospital systems, UCs, Stanford, USCs, Scripps, and others, including our national labs, to make sure that we're really advancing and continuing to promote more protocols on therapeutics, which are profoundly important as we bridge ultimately towards the herd immunity and the vaccine within, we hope, the next year or so. Number 5 is the incredible importance of redrawing our floor plans. And that is quite literally a responsibility if we are moving into a next phase of our businesses so that we can practice safe physical distancing within the premise of a business, within and around a school site, and facilities, large and small, public and private, all throughout the state of California. So quite literal strategies, guidelines, and expectations on what physical distancing would look like within those facilities, not just broadly out on the streets, our parks, playgrounds, and in our coastlines. And finally, our capacity always to turn on that faucet again and reinstate more vigorous controls. And that's just a process that will perhaps be the most challenging if indeed we lean in, but we have to then lean back out as we toggle from stricter to looser interventions, back and forth. As things change, as data comes in, as health concerns make themselves real in terms of that data, or at least more obvious, our capacity to pull you back in and to encourage people to advance the social distancing, the stay-at-home and physical distancing that has gotten us to this point today. And so that's the framework. Those are the 6 frames of focus that we will monitor and that we will process as we make the determination through this process of architecting a next phase in this pandemic that we will be processing, at least making more public here today. With that, I want to ask Dr. Angel now to come up. She'll walk through a number of those steps, and we'll try to answer and anticipate as many of your questions as we can in the outset. I'll come back up. I'll talk a little bit more about what normal may look like, because normal is anything but. And I'll be honest and sober about that as it relates to that bridge ultimately towards the vaccine. And I'll just end before I ask the doctor by making this point. I recognize what you recognize. 2 things: that you, individuals, through the extraordinary behavior, millions of you, because you have practiced physical distancing, the stay-at-home orders, you have bent the curve in the state of California. The models have changed because of your behavior. And that puts us in a position to be able to socialize, again, to make public these private conversations we've been having about this next phase. But number 2, we do so soberly, because today we had a record number of deaths that we are reporting. 758 individual stories, families, and lives torn apart. 71 individuals that lost their lives just since the last reporting that I gave you yesterday. We are sober about the fact we're still seeing an increase, modest though it may be, in hospitalizations, but also the total number of individuals tested, that we are not out of the woods yet, and we are not spiking the ball. But we also extend a recognition in that light that this can't be a permanent state. And I want you to know it's not. It will not be a permanent state. We recognize the consequences of these stay-at-home orders have a profound impact on the economy, your personal household budget, your personal prospects around your future. If you've just lost a job or you lost wages, or you're struggling with your dream, and that is to keep your dream afloat as a business person that may have put everything on the line, and you were talking about the next 5 to 10 years on that journey and how vulnerable, because of the stay-at-home orders, those dreams are to this new reality. We recognize that the stay-at-home orders impact all of us differently. Certainly impacts those of low income differently than people with means. It impacts communities differently depending on the resources within those communities and the capacity for community members to all come together and help support one another. It's limited in certain parts of our state. And of course, the impact to the healthcare system. They've done such a magnificent job, not just anticipating a surge, but decompressing their own system, creating slack. And that's had a profound economic consequence on our healthcare delivery system, not just the hospitals, but primary care physicians, surgical operations, community clinics, and the like. And if this were the new normal, those systems would be devastated in a way that would be difficult even if there's a strong V-shaped recovery to recover any time soon, and could actually create more health problems down the road as we continue to delay elected surgeries that no longer become elected surgeries, or we're not doing our checkups and preventative work that ultimately become acute care issues. Again, all of these things we recognize require us to begin to at least make public our thinking as we transition from surge to suppression and ultimately bridging towards herd immunity and immunizations.